Dr. Suachla, Scientific Director with Ziva Fertility Center. Know your blood tests, know your investigations which are done during infertility treatment. I'd like to talk to you in detail about the various investigations that are done when you come for infertility treatment. So let's divide them into two main things. First of all, male and female. We'll talk about the female first. There are some blood tests, some very important blood tests that give us an indication of how the periods are, how your hormone levels might be, if your egg is ovulating, if you're having comfortable periods, as in if you are suffering from endometriosis or have PCOD issues. Now these blood tests throw a lot of light on your hormonal status, your uterine status, your ovulatory function. All these things we can kind of understand through these blood tests. There are a few examples that I would take names of. These are called as FSH, follicle stimulating hormone, LH, luteinizing hormone, AMH, anti-Mullerian hormone. There are thyroid stimulating hormones, prolactin, inhibin. All these give us an indication about what's happening. There is estradiol, there is progesterone. All these tell us how the eggs are ovulating and how your endometrium is behaving, and whether there is a proper function between the brain and the uterus so that hormones are flowing properly and your periods are regularized. Next, we do ultrasonography. This is a very important investigation where a very simple scan, so as to say, is performed to see how your uterus is. Now this scan looks at your uterus very carefully. It's a transvaginal scan usually, and the uterus is looked for any fibroids or muscular outgrowths. Polyps are also outgrowths inside the uterus. There could be endometriotic lesions inside. There could be scarring inside from previous surgery. All these things can be looked at with a ultrasonography, which is performed at a particular time. So ultrasonography is also very important. Next, there is something called as hysterosalpingogram. This is a very important investigation which looks at your tubes. The tubes are a very, very critical part of the reproductive system in a woman's body. What happens is when the eggs are ovulating from the ovaries, the tubes catch them and the egg waits inside the tube for sperms to arrive, and fertilization occurs inside the tube. So you can imagine, if anything is blocked or is semi-blocked, or there is infection there, or there is scarring there, the fertilization cannot happen. So that's the critical role of tubes. And HSG is a very important test, which is a normal test where a dye is passed into the uterus, and when it spills from both sides of the tubes, it depicts that the both tubes are open and patent. That's a very important test as well. When it comes to male, the most important test that we do is a semen analysis. Now this looks for the count of sperms. It looks for the motility, because motile sperms only can reach the egg and fertilize an egg and bring about the formation of an embryo. So it's very critical that we look at the motility as well, and we look at morphology. Now the shape is very important. The shape of a sperm has to be one certain way so that it can swim accurately towards the sperm and fertilize it. If the head is bent, if the tail is not good, if it's too fat, too thin, too small, it does not reach the egg and cannot survive the hostile environment of the uterus. So morphology is very easy. How do we do this? We do it by looking at standards which are set up by World Health Organization. They have set up studying thousands and lakhs of patients, and they have said a certain number should be present, a certain motility percentage should be present, and certain percentage of morphologically normal sperm should be present for us to be able to say that the man is having a chance at fertility. So this is a very critical thing. Now for both the male and the female, there are some genetic tests that could be done. Is that the reason? Are there any mutations in your chromosomes which are causing fertility? That's assessed. And then there could be an infection screening as well. Do you have any infections like chlamydia or tuberculosis or gonorrhea or syphilis which is causing infertility? So infection screening is also a very critical aspect of investigations when it comes to infertility treatment. We also look at any anatomical problems that you could be having congenitally. Now there could be a uterus missing, there could be a tube missing, there could be a deformity in the uterus, there could be a blockage in the tubes which are present in the seminal vesicles. So there are so many things that could happen anatomically, congenitally, as it by birth, which could result in infertility. So that is also assessed by ultrasonography or laparoscopy. All these things are assessed. Then last but not the least, in spite of doing all these tests and investigations, 15% of couples, we are still not able to put a finger on decide what the factor is which is causing infertility. These are called as idiopathic reasons, where we are not able to decide what the cause of infertility is, and treatment options are given to such patients where we can enhance the success rate and bring about pregnancy. If you want to understand more about the investigations, you want to get these investigations done yourself, you're trying for pregnancy, you want to understand how to do it, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.